Could these people please come to the podium so I won't forget? Therese Wolf, Leslie McGee, and you get a car, and you get a car. No, Mary Griffin. Okay. Mary Griffin, is Mary in here? And Jacqueline Stockel. Is Jacqueline in here? And you get a car. I feel like I wish I was Oprah and I could do that. Just give me those diamond earrings. Okay, so a couple of housekeeping things before we get started with the last and final general session. I am to let the members of the National Association of State Foster Care Managers know that their business meeting is at 5:30 p.m. this evening in Plaza B. So the NAS FCM business meeting begins at 5:30 p.m. this evening in Plaza B. Also, we know that the associations, NASAP, and the foster care managers are having their individual association meetings. NASAP meeting will take place, breakfast will be at 8:30, and the meeting will begin at 9 p.m. sharp in Salon 2. Again, NASAP, breakfast, 8:30, meeting, 9 p.m. sharp. AM, I'm sorry, y'all know I'm tired. We're going to meet all night long, even in my dreams. Be like Lionel Richie all night long. AM in Salon 2. And then the foster care managers, guess what? You get to get up a little bit earlier. Wow. I mean, those diligent foster care workers. 7:30 a.m. is your breakfast. Delicious fruit at 7:30. And your meeting begins at 8 a.m. sharp in Salon 1. Did I say a.m.? Did I say p.m. again? No. Okay, a.m. Okay, so Rashonda's going to introduce our last, one more thing, evaluation. We will be putting, our data person is not here, our outside evaluator is not here, but we will be putting evaluation forms on your tables. Please, please, please fill those out because they really do help us with the planning in the next year. And we know that data is very important. So if you could please complete those evaluations and then give them to anybody who has the green staff form on their badge, that would be great, or else leave them on your tables. Okay, take it away.
All right, I'm ready. I want to say thank you for everybody to come back. I mean, this is a packed room after a long day, but you do not want to miss this because you are here for the federal updates. So I'm going to introduce everybody at one time so that way we can keep things flowing since you have a meeting at 5:30. I'm sorry about that, but this is how these meetings come. You come here to work. So our first presenter will be Jan Schaefer. She is the Director of Division of Research and Innovation at the Children's Bureau, and she's going to talk to us about awards and grant forecasts. So that is definitely going to be exciting. You're going to want to make sure you take notes on that. Then, of course, I know you all love this word for sure. It's called CFSR. I know you know what that stands for. So we have the lovely Miss Esther Sherrod here, and she's also going to be presenting along with Miss Miranda Lynch Thomas. So Esther Sherrod is a child welfare program specialist, of course, at the Children's Bureau in the CFSR unit. Across the country works with states in developing program improvement plans. We know what that is as well. Previously, Ms. Sherrod worked in child welfare at the state level as a social worker and director of quality assurance. But this is the best part about her. She is in the process of becoming a licensed foster parent and a permanent connection for youth and older children in Virginia. So not only does she walk the talk, but she does what she needs to do. We also have Miss Miranda Thomas, which is the supervisor for Children and Family Program Specialist for the Child and Family Service Review Team. In this role, she assists in the Children's Bureau monitoring of state child welfare systems, program improvement effort. She comes to this position after several years in the policy division, and we still go to her for stuff about policy, even though we're not supposed to, and she just doesn't say no, so that's a good thing. Also, after that, we will have, going to the policy division, we will have Ms. Elizabeth Sharp. Of course, she is a member of the policy division at the Children's Bureau, where she develops policy and regulations related to 4E and 4B in CAPTA. In particular, she focused on implementation work surrounding fostering connection. Those that were here last year, you know she did an excellent job in breaking down fostering connections for us. So Ms. Sharp joined the Policy Division in 2007 as a Presidential Management Fellow after graduating from Northwestern University School of Law. So here we go. It's going to get exciting. So get your paper out and let's take those notes.
Thank you, Rashonda, and good afternoon, everyone. I'm Jan Schaefer, Division Director for Research and Innovation. And as I had hoped, the grant forecasts for 2012 just published today. So I could stand up here and tell you what we think we're going to publish in 2012. So let me do that first. And also, you don't have to take copious notes because all of this information has gone out or will go out in an email blast to everyone on our listservs. So you'll have it in your mailbox. The forecasts are really interesting. We will again be doing tribal Title IV plan development grants. And I would say we're really interested in generating more applications in that area. So if you have any connections, please make that happen. Comprehensive support services for families affected by substance abuse and HIV/AIDS. And that will be under Abandoned Infants Assistance. So for those of you who are connected to those programs, get ready to produce some applications. Adopt Us Kids. And we will have under Fostering Connections, the Family Connection grants will be competed again in the upcoming year, so keep an eye on that. Now, particularly of interest, we will be doing improving service delivery to youth in the child welfare system. We will be doing integrating trauma-informed practice in child welfare, and we'll be doing 2 education collaborations, one early education and child welfare collaborations, and then educational stability for older youth. So if any of you were involved in either being an applicant or participating in writing an application, you'll note that 4 of the areas that we published in 2011 will be published again in 2012. And that's very unusual for us because typically we redesign our discretionary areas year after year. So this is one of the few opportunities that applicants have had to take their application, if it was not funded, and polish it up and then submit again in the next year. Again, if any of you were unsuccessful applicants, you'll be receiving a letter and you'll be receiving reviewer comments of the strengths and weaknesses of your application. So you'll have the opportunity to use that information to improve your application in the upcoming year. The only caution I would offer is to make sure that you read the new funding opportunity announcement because they will have been edited. There might be some little small changes in focus. And it's going to be very important that your application is responsive to the new announcement and written toward the evaluation criteria. So that is the big news. Secondly, I wanted to share with you that we just, and I'm sure all of you have seen this, we just announced the new awards for 2011. And under that, we funded 44 grants competitively in 27 states. And that again is posted on our website and has gone out in email blasts so you can check out who received those awards. And finally, I wanted to do a little public service announcement and ask that any of you who are interested in becoming grant reviewers, that there's a spot on the Children's Bureau website under discretionary grants where you can scroll down and register to become a grant reviewer. And we really encourage you to do that. We have a pretty broad database and we have some great folks who have done it for us year after year. We always encourage new reviewers and love to expand that pool. So if you or your colleagues are interested in doing that, please register. If you have overeducated and underemployed children or family members, it might be a great chance for them to get involved with us. And as we publish our announcements, I'd also encourage you to check out who the program contact person is. And if you'd like to be a reviewer in that area, just give that person a call so that, you know, you are on the top of the list as we start to, reach out to grant reviewers. So thank you. If you applied, please apply this year. And that's all I have. Thanks.
All right, good afternoon, everybody. It's a pleasure to be here with you today. We've completed the second round of Child and Family Services reviews and wanted to present some of the information that we've been able to glean out of the findings. We've got a lot more work to do as we continue our analysis, but we wanted to be able to share some of the findings with you during this conference. So the analysis that I'm going to share with you includes information from all 52 states. It includes the data from all the cases that were reviewed in the on-site reviews. We've got 3,363 cases. It's a lot of hours of review time put into those cases. And the cases are both foster care and in-home cases. For many of you who are familiar with the CFSR, you know that it includes a statewide assessment that the state completes in preparation for the on-site review. Included in that assessment is a data profile that includes national data related to the national standards that had been developed. Then we have the on-site review where we look at 65 cases in each state, conduct stakeholder interviews to get information about systemic factors, and then we complete our assessment of outcomes and systemic factors, and we've got 7 outcomes and 7 systemic factors that we assess. And then once that's completed and the final report was issued, then states enter into their 2-year program improvement plan, which is then supported and monitored by the Children's Bureau. I want to begin the presentation going over some of the findings from the systemic factors. I do want to spend most of our time talking about the outcomes. I think that's probably the most interesting and maybe the most relevant to some of the work that you're doing. The systemic factors that we assess through the review process include the statewide information system, the case review system, quality assurance, staff and provider training, service array and resource development, agency responsiveness to the community, and foster and adoptive parent licensing, recruitment, and retention. So here's the spread of the findings across all of those systemic factors. So for each one of the systemic factors, we have the number of states that were in substantial conformity. So with state information system, we had 40 states in conformity. Case review system just had 2 states. Quality assurance, 40 states. Staff and provider training, 36 states. Service array, we had 10 states. Agency responsiveness, 51. And foster parent licensing, recruitment, and retention, we had 38 states who were in substantial conformity. I want to spend a little bit of time talking more specifically about the case review system and the service array, since those were the areas that states struggled the most with. The systemic factor for case review system looks at several items. These include the written case plan, which is looking at parent involvement in developing that case plan, periodic reviews being held for children within the accurate timeframes, permanency hearings at 12 months, whether the state has a process to ensure termination of parental rights in compliance with ASFA, and notification of hearings and reviews to caregivers. So looking at each of these items, you can see kind of the spread how states performed for each of those. So the best performance was in item 25, which is looking at, I'm sorry, the worst performance was item 25. I can't even see the 0 there. So none of the states, unfortunately, had been able to achieve a strength rating for involving parents consistently in case plan development across the board. So again, this is looking at it from a systemic point of view, not just specific cases, but do they have a process in place to ensure that for every case plan that's developed, parents will definitely be involved in that. The periodic reviews, most states, 44 states, were in compliance there. Permanency hearings, we had 32 states. The TPR processed 12 states, and then notification of foster parents was at 14 states. The second systemic factor we wanted to look at was service array and resource development, and I'll talk specifically about the items when we look at the chart here. So 32 states were in compliance with item 35, which is looking at the array of services that the state has and whether they have an array that will meet the needs of the children and families that they're serving. Item 36 looks at the availability of that array of services and if that's available statewide, and one state was rated a strength there. And then item 37 looks at whether those services can be individualized to meet unique needs that families and children have, and 18 states rated strength there. So I want to move into the outcomes, and we have 7 outcomes that we assess for throughout the Child and Family Service Review, 2 on safety, 2 on permanency, and 3 on well-being, and we'll spend time talking about each of these specifically as we look at the data. Before we go into the specific findings, I did want to note that we found some correlations between case characteristics and the ratings for some outcomes and items. We have a number of different correlations, but I just wanted to draw attention to these 2. Foster care cases were more likely than in-home service cases to substantially achieve outcomes or be rated strength for items. So across all the items that were in-home cases and foster care cases were being rated, the foster care cases were rated stronger. And then cases were more likely to be rated strength for services to mothers than to fathers. So again, across those items, when we look at both parents, services to mothers rated stronger than for fathers. And I know a lot of you are very familiar and probably involved with a lot of fatherhood initiatives to try to remedy this. So I know there's been a lot of tremendous work that's gone into this, and we're hoping that we'll see some improvements in that over time. So looking at the spread of outcomes, this is the mean state performance, percentage of cases that were rated substantially achieved for these outcomes. So safety outcome 1, which looks at children first and foremost being protected from abuse and neglect, was at 73.1%, rated substantially achieved. Safety 2, children are safely maintained in their homes whenever possible and appropriate, was at 65.1%. Permanency outcome 1, children have permanency and stability in their living situations, was 38.2% substantially achieved. Permanency outcome 2, the continuity of family relationships and connections is being preserved for children, that was at 64.5%. Well-being 1, families have enhanced capacity to provide for their children's needs, 42.1%. Well-being 2, children receive appropriate services to meet their educational needs. We also look at assessment there, and that was 86.6, the highest rated outcome. And well-being 3, children receive adequate services to meet their physical health needs. That looks at physical and dental health, and that was at 75.3%. So looking specifically at the safety outcome, those outcomes have 4 items attached to them. So we're looking at timeliness of initiating investigations, occurrences of repeat maltreatment, the services that were provided to prevent placement into foster care and to preserve children and their families safely, and then risk assessment and safety management. So for these specific items, you can see kind of the spread of the cases that were rated strength. So most of the safety items rated fairly high. When you look across all the different outcomes, safety did fairly well, which we're very proud of and happy about, because we definitely want to ensure that children are safe once they come into our child welfare systems. The one item that I want to spend a little time talking about is item 4, which looks at ongoing risk and safety assessment. But before we go into that, again, just wanted to mention a couple of the strengths we noted for items 1, 2, and 3. So in the cases that were reviewed, we did see some really good work at ensuring timely face-to-face contacts with children during their investigations. A lot of states have different priority levels assigned depending on what the circumstances are, and even despite having different priorities, we did see really good efforts in ensuring that those visits were, those contacts were being made. A lot of the cases that were reviewed did not have occurrences of repeat maltreatment, or if they did, the circumstances could not have been prevented by anything that the agency was doing. So that also rated pretty well. And then we did see some really good work in providing services to prevent removal and really supporting children staying in their family homes safely when it was appropriate. So looking specifically at item 4, we look at both initial and ongoing assessments in this item. So as you can tell by the percentages there, practice was a little bit stronger in ensuring that initial assessments were happening both for risk and for safety. And then it dropped off just a little bit when we're looking at ongoing assessments and making sure that throughout the life of a case that, that risk and safety is being continually assessed. And then one of the other things we look at is whether safety assessments were conducted before closing cases, and on the foster care cases, that happened in 74% of cases. Some of the safety concerns that were identified, in 22% of the cases, there were safety concerns that the reviewers felt were not addressed adequately, and these included maltreatment allegations. A lot were surrounding maltreatment allegations that were either reported and inappropriately screened out, or never reported formally and therefore never formally investigated. Extensive delays in accepting allegations for investigation or assessment. Allegations not being substantiated despite evidence that would support a substantiation, and then cases being closed prematurely where their services had not yet been provided that were going to remove risk and safety factors, or for various reasons the reviewers felt that the case was being closed prematurely and that raised concerns related to safety. Moving into our permanency outcome, we have 2 permanency outcomes and many items under those. So this is kind of the spread of how cases were rated strength on each of those items. The items in red were the lower performing states, and we'll spend a little bit of time talking about those. And we'll go through some of these more specifically, but I just wanted to highlight the areas that we saw really good practice in. Item 5 is foster care reentries, and again, in a lot of the cases that were reviewed, there were very few instances where reentry was occurring on those cases, so they were rated strength. Item 6, where placement stability was ensured for children, we saw great work around making sure that foster parents had the services that they needed to support children in placement. Children were being placed in homes that eventually became permanent homes, so they didn't require a move once their permanency goal changed. So some really good practice that we identified in those areas. Looking at item 11, proximity of the child's foster care placement, we saw some excellent work being done to ensure that children were being placed close to their homes. And I know we had heard in stakeholder interviews about targeted recruitment efforts, and I think some of those are really paying off in ensuring that children get to stay close to their biological families, and that really helps to support a lot of the other permanency outcomes, which is great. Item 12 was also rated pretty high. That's visitation with siblings and with parents. And then item 14 is looking at preserving connections. And so we saw some really good work in ensuring that children's connections are preserved in their community, with their families, extended families, friends, school. So wanted to highlight some of those things. So for the cases that were reviewed, this is kind of a list of all the goals that we had identified for those children. We did have cases that had concurrent goals, and we didn't include the concurrent goals in this chart. So this is the spread of goals for the children that were reviewed in the cases. So most of the children had a goal of adoption, 38.2%, and then reunification with parents was the second highest goal. Other planned permanent living arrangement was the goal for 21% of children, guardianship 4.9, and reunification with relatives 3.2. Some of the common challenges that we identified in a few of these items. With item 6, again, that's placement stability, not having enough foster placements available to meet the needs of children was a significant concern that resulted in multiple moves for kids. Also, lack of appropriate training for foster parents. Some of the cases, children had very specific needs, unique needs, and foster parents just were not trained adequately to deal with those behaviors or issues. And then having a limited resources to support foster parents. So not having enough access to services for foster parents to support maintaining placements. With item 7, we're looking at appropriate permanency goals for children being set in a timely manner, compliance with ASFA requirements, and filing for TPR. So in some of those cases, some of the challenges we saw, concurrent planning wasn't being implemented consistently or effectively. So in some cases, they would identify a concurrent goal and it would be listed in the case plan, but that was kind of the extent to which it was happening. There wasn't any active work being done on that, on both goals. In some cases, there were inappropriate goals being set for children based on what their needs were, based on the circumstances of the case. Goals weren't being set in a timely manner in all cases, and then there were issues with TPR, termination of parental rights, not being filed in accordance with ASFA, and not having the documentation for compelling reasons when it wasn't. Looking at item 8, this is reunification, guardianship, and permanent placement with relatives. We're looking at the time frame to achieving this goal, and 12 months was typically kind of our marker for an appropriate time frame. So some of the strengths that we saw in this item, identifying when workers had identified, engaged all members of the family in the case plan, we really saw that impacting the time frame to reunification or guardianship or placement with relatives. I'm not going to go through all of these, but a few that I just want to highlight. Designing and adjusting visitation plans, so really making sure that visits were occurring in a way that supported timely reunification. So once it was safe enough, allowing as liberal as possible visitation with parents, doing overnights to prepare for reunification, we saw that practice really helping to support timely achievement of this goal. Again, effective use of concurrent planning contributed to timely achievement of the goal, and then supporting foster caregivers as mentors with birth parents. And we saw in a lot of states, you know, kind of this practice really evolving and growing and really encouraging birth families and foster families to work together. And so when we did see that happen in cases, we saw the effect that had on getting to either more timely reunification in these cases or just timely permanency in general, because the foster parent and birth parent really had a strong relationship, and it wasn't kind of this fight against each other, which oftentimes delays things. Some of the challenges in this area that we noted, and again, I'm not going to go through the entire list, and a lot of the challenges that we noted are issues that we saw in other items throughout the CFSR as well. So it's interesting to kind of see how all these different practice areas impact each other. But specifically, some of the services were not available for families to achieve timely reunification. And I know we talked earlier about service array and the concerns with that systemic factor, and I think we definitely saw a direct impact in states' abilities to provide all the services that families need to safely reunify with their children. So some specific services that were identified were residential treatment, transportation, housing services, employment assistance, mental health treatment services, and substance abuse treatment. So specifically those kinds of services that were really necessary to ensure timely and safe reunification were either not available or were just not provided to parents. Looking at item 9, adoption, these are some of the strengths that we identified as themes across the cases. So just a really good attention to time frames in these cases. So although the child may have been placed in an adoptive home, not just waiting for the months to go by, but really ensuring that paperwork was getting completed and everything was set so that by the time a TPR happened, you could move quickly to adoption. We also saw obtaining voluntary relinquishments early on in cases when it was appropriate. Again, the use of concurrent planning was effective in achieving timely adoption. Preserving existing services for children post-adoption, I thought, was a unique one. And I remember hearing some cases where, you know, the adoptive parents were really unsure about wanting to finalize anything if that meant they didn't have access any longer to the services that they were really relying on to provide care for their child. So in cases where the workers ensured that there was going to be a transition to either other services or they could maintain those services, we saw that really adding to and ensuring timely achievement of the goal. Some of the challenges in this area, again, similar to some of the other items we'll talk about, not engaging families effectively, not being compliant with ASFA timeframes for TPR. So the delays in TPR would result in delays in timely adoption. lack of planning for post-adoptive services, which is related to what I just mentioned. And delays in setting the goal of adoption. So in cases, especially if there wasn't concurrent planning or they kind of waited until the permanency hearing to decide what was going to happen and then placed a goal of adoption, that really delayed achievement of the goal. And then finally, in item 10, other permanent plan living arrangements, some of the strengths we saw, really supporting the relationship of the child with their caregiver. So if this was going to be the permanent placement for that child, really ensuring that they had the best, most optimal relationship to support that child through aging out of care and gaining independence. Engaging relatives and siblings to make sure that child had ongoing connections. Addressing runaway and delinquency episodes, addressing mental and developmental health needs. Those things really contributed to this item being rated strength. And then some of the challenges in that area, not paying enough attention to behavioral concerns, and that would result in the placement not being stable and needing to find another plan for the child. Overusing temporary placements, and then concerns with just not having adequate independent living services to prepare those children for independence and make sure that that was a permanent and stable situation for them. Okay, we're moving into the second permanency outcome, and here we're looking at these items that really do, it's pretty interesting how, and we'll talk about this a little later, how they correlate to overall achievement of permanency. So these, I think sometimes these things may be thought of as the extra things that caseworkers have to do, ensuring that they see their siblings and making sure they have a relationship with their parent outside of visitation. But those are the things that really we saw contribute to timely achievement of permanency. So wanted to spend a little bit of time talking about that. Some of the strengths that we saw in four of the items rated pretty highly in this permanency outcome. Agency efforts to place children in close proximity, I mentioned that earlier. Item 11, placing siblings together. Item 12, preserving children's connections. And item 14, and seeking out relative placements in item 15. So we did see really good practice in those areas, really great efforts to ensure that that was happening for children consistently. The two areas that were rated lower were item 13 and item 16. Item 13 is looking at visitation with parents and siblings. We did note stronger practice in the area of sibling visitation, so only in 36% of states did we see that there were not any concerted efforts made to ensure that they could have sufficient visitation, but in the rest of the states we did see that that was happening, and again, I think placing siblings together, which was happening very frequently, helped with this. But when it came to fathers, I think there's still a significant amount of room for improvement. There weren't not any concerted efforts to ensure sufficient visitation with fathers in 82% of states that were reviewed, and then concerted efforts to ensure visitation with moms in 62% of states. So I think visitation, again, is an area that I know resources was cited as a reason why they weren't having as frequent visits, but when we think about the impact that visitation has on achieving timely permanency and really maintaining that connection and the motivation for the parent and all those different things, I think definitely warrants a look at how we can improve this area of practice. And then item 16 is the other area that was rated poorly, relationship of child in foster care with their parents. So aside from visitation, what efforts is the agency making to really support and nurture that relationship? Do they get to go to doctor visits and talent shows and extracurricular activities together if it's safe, and are they making arrangements for that to happen? So the agency made diligent efforts to support or maintain that bond with children, with mothers in 68% of cases and with fathers in 52% of cases. Okay, our last outcome, well-being. So we have 7 well-being items. Well-being outcome 1 is 17 through 20. And we'll spend some time talking about those in detail because that was one of the lowest rated outcomes. But you'll see that our areas for education, physical health, and mental health were some of the highest rated items, 87, 86, and 77%. So we really saw some great work and had heard about in stakeholder interviews the kind of collaboration that's taking place at the state level with other state agencies, health agencies, education, to really ensure that children are getting the right kinds of assessments and have access to the right kinds of services. So it was really great to hear about all these partnerships being developed and really unique things coming out of those. So we definitely wanted to highlight those findings here as well. Looking specifically at Wellbeing Outcome 1, here we look at assessment of needs for children, parents, and foster parents, and then services to meet those needs, involvement of the child and the family in case planning, and then caseworker visits with children and with parents. So we have information about, for each parent and the children and foster parents, the percent of cases where needs were assessed, and then the percent of cases where needs were addressed through services. So across the board, there was a lot better practice in terms of assessing the needs, and then it fell off a little bit in ensuring that we had provided services to address those needs. So in some cases, they were unmet needs that were never met during the life of the case, or it took time to address all of them throughout that case. Before I go to 18, I do want to talk about some of the things that we identified that worked well for assessing needs. So, and again, it relates to other areas of practice. So in cases where they did a great job engaging with the family and meeting with the family regularly, then the quality of assessments improved. They were seeing the parent often enough to keep updating those assessments and revising service plans so that it was meeting the parent's needs that were changing over time. So we did see some good things happening and definitely want to build on those strengths as we look at ways to improve this area. For item 18, involvement in case planning, here the child welfare agencies made concerted efforts to involve mothers in case planning in 71% of the cases, fathers in 47%, and children in 70%. So children and mothers are kind of at the same level, and again, fathers a little lower than the rest. And then Wellbeing Outcome 1 also looks at visitation between the caseworker and the parent, and caseworker and the children. The frequency and quality of visits between the caseworker and between mothers, frequency was at 67% and quality at 69%. Fathers, 41% frequency, 52% quality. And children was 81% frequency and 75% quality. And I did want to talk a little bit about some of the things we identified in cases that rated well in these areas. I do think caseworker visits with children and parents is significantly important in how it impacts the rest of the outcomes and the rest of the case practice that we're looking at. So some of the things that we saw that facilitated frequent and quality visits included caseworkers using interpreters to meet with families when there was a language barrier, and not just assuming that there was an understanding, but really ensuring that they had access to those interpretive services to have a meaningful quality visit. Taking the time, or making sure that visits occurred according to parents' schedules, in the evenings, on weekends, when the parent wasn't working, so really accommodating the parents' needs. And I know that's not easy to do, but in the cases where they did it, it really paid off. Caseworkers assisted parents with accessing needed services and made appropriate referrals during those visits. So the visit wasn't just a, hey, how are you doing? But it was really an active opportunity for parents and workers to work together to get access to the services that they needed. And then caseworkers are really persistent in the efforts to locate parents and to engage them. So if parents couldn't be located, it wasn't just kind of dropped off at the beginning of the case, but there was consistent effort to locate parents, to use search processes that are now available, to really go above and beyond to ensure that we're doing everything we can to locate and engage these parents throughout the life of the case. And then engaging parents who were incarcerated. That was another area where cases rated well. It was because, again, they went to that extent to ensure that just because a parent was incarcerated didn't mean that they didn't have contact. So whether it was phone contact or letters or mailing case plans, they were still being involved and engaged appropriately. And then during the visits, really ensuring that well-being needs, safety issues were being adequately assessed. So the quality of the visit, they were really taking the time to get to know parents and build a rapport and develop a working relationship so that they could complete really accurate assessments of those things. Okay, lastly, well-being outcomes 2 and 3, looking at education, physical health, and mental health. So again, we're looking at assessing the needs and then providing services to meet those needs. So these were the highest rated outcomes across all the outcomes reviewed. So we saw some excellent work here again, I've mentioned. So with regard to educational needs, children's needs were assessed in 90% of the cases, which is excellent. And those needs were being addressed in 85% of the cases. For physical and mental health, their needs were being assessed in 93% of the cases and addressed in 90%. Mental health and behavioral health needs were being assessed in 86% of cases and then having those needs met in 77% of cases. So in the few cases where it wasn't a strength and there were some concerns, some of the challenges we identified in education, there were some concerns with maintaining or coordinating educational services due to communication barriers, problems with the education system, delays in transferring records, delays in enrollment. For item 22, physical health, dental services were a big thing that were lacking in communities, so that's why needs couldn't be met in that area. And then in mental health and behavioral health, again, having insufficient services to meet needs in certain communities. And then in some situations, assessing the need but not addressing it. And then having delays in assessments due to wait lists for services. We identified some relationships between performance on outcomes and item ratings. And again, I mentioned this earlier, but I think it's really helpful to kind of think about how all these different items and outcomes sort of relate to one another as we talk about and help agencies improve their practice. So one of the things we found is that permanency outcome 1, which is looking at children having permanency and stability in their living situations, that outcome was positively associated with strong practice in item 14, which is preserving connections, ensuring relative placement, item 15, assessing parent needs and providing them with needed services, and frequent quality worker visits with parents. So really thinking about, even for supervisors, supervisors have a ton of things that they have to work on with their workers, but really kind of honing in on some of these key practice areas and thinking about the implications that will have for some of these broader outcomes. And then in well-being, outcome 1, families have enhanced capacity to provide for their children's needs. We saw that outcome was positively associated with all the items except for repeat maltreatment. And there was a strong, and it had the strongest associations with appropriate safety and risk assessments, visitation with parents and siblings, and the relationship of the child in care with their parents. So again, really thinking through how we can focus on some of these key practice areas and build practice so that we can improve these outcomes for children and families. We wanted to give you a status of where states are in the round 2 program improvement plans. 8 states have already completed their round 2 program improvement plans. 42 states are currently in implementation or they're being monitored in their non-overlapping year. And 2 states are still pending their initial PIP approval. So that's where we're at. Folks are very busy, I know. We're going to have time for questions after Miranda's presentation. So thank you very much.
Good afternoon, everyone. I hope you can stand just a few more minutes on CFSR. So now that you've heard about some of the overall results from round 2, I did want to just say a few words about the possibilities for round 3. ACF, just a few. ACF is actively considering changes to the CFSR process for round 3. I hope that's not a surprise to many of you. As you may have recalled seeing, CB issued a Federal Register notice back in April of this year soliciting feedback from the public
We took both written comments and then we also did consultations across the country and convened stakeholders and tribal leaders and administrators in those discussions. We received about 80 written comments from a variety of stakeholders, and we had about 50 people join us in those live consultation sessions, and additional 50 tribal leaders and administrators. So I just wanted to talk about some of the themes that have emerged from what we heard from you. We understand, or we think we understand, that there are a number of stakeholders that are interested in a CFSR that can better institutionalize continuous quality improvement in your child welfare systems. You're interested in identifying the most appropriate system change initiatives, encouraging refinement and mid-course corrections, and really being able to support long-term sustainability of improvement efforts. And some of this has arisen out of commenters' concerns about losing momentum in between the rounds. There is a long period of time between round 1 and round 2, and potentially for round 3. And sometimes there is some momentum that is lost. Resources sometimes get taken away to do quality assurance activities so you can stay on top of your improvement efforts and make corrections over time. We also heard from stakeholders that you're interested in incorporating some of the new Title 4B and 4E plan requirements into our federal monitoring efforts, particularly those from Fostering Connections. In particular, we heard that some commenters wanted educational stability to be more of a focus in the CFSR, provisions related to older youth, and because Indian tribes will now have the ability to receive direct funding of Title 4E funds, we heard that that is really an opportunity to tailor a review process to Indian tribes and to Indian children, more so than with the current review process. We heard from stakeholders that you are interested in uncovering programs and practices that are unique to specific populations. Indian tribal children is one of those. Racial disparity and disproportionality issues is another area that you would like to focus on. And focusing on youth who are lesbian, gay, bisexual, transgender, or questioning. So there are some particular populations that you just have a lot of interest in. You would like to figure out ways to better serve them, and so you're interested in figuring out how to do that with an overall monitoring process. We also heard that many of you are interested in a refined set of measures for the CFSR. You do still want to focus on safety, permanency, and well-being, and systemic capacity, but you're also interested in taking more of your own state and local challenges into account, your specific policies and procedures, and so you're looking for options of flexibility there. We definitely did hear some particular things about the composites, the specific measures. We know that there's also some concerns about the small sample and the purposive kind of sampling that we do in our reviews, and that might not always get at the wide range of practices that you have within your states and your jurisdictions. We also heard that you want to integrate the CFSR into existing ACF protocols for monitoring, particularly the Title 4B Child and Family Services Plan that is already an existing process where you have to gather a lot of information about your state and take a look at where you are and where you would like to go in a few years. And so you're still looking for ways to combine these processes to reduce the burden on you as states and to really have more of a picture of what's going on in the state than might be the opportunity for in a CFSR as it exists now. And we also heard that you want to focus on accountability still, but you are interested in a different mix of maybe penalties balanced with incentives in a different way. So that is also something that we're taking a look at. So all of those comments, and there were really many more, are possibilities that are on the table. We have not made any final decisions at this point, We are considering whether we would need regulations or not, depending on the direction that we would want to go. And we really look forward to working with you as administrators and stakeholders on the new direction if we take one for the CFSR. In the meantime, of course, there's a lot of work to be done. We're encouraged by what we have seen in round 2 and some of the strengths that we have identified, but there's also room for continuing improvements. And so we look forward to continuing to work with you on those improvements as they exist right now. So with that, I'll take some questions, or maybe Esther will take some questions based on the presentation. All right. Okay. Thank you.
So I originally thought I wasn't going to have a lot to talk to you about, and either fortunately or unfortunately for you, Congress passed a law in the meantime. So today I'm going to tell you a little bit about what is a 4B reauthorization that also makes some changes to Title 4E. And it's called PL, Public Law 11234, the Child and Family Services Improvement and Innovation Act. So like I said, in general, this makes some changes. It extends programs funded under Title 4B through fiscal year 2016. It also makes some changes to Title 4E, one of the most exciting ones being that it authorizes new demonstration projects. And generally, these provisions became effective October 1st of this year, unless I tell you otherwise. There's just very few exceptions. So first, I'm going to talk about the amendments to Title 4B, Subpart 1. The reauthorization maintains the current funding levels for Subpart 1, and as I said before, all of these changes went into effect October 1st this year. And I will add that the law was actually signed into law on September 30th, so it was cutting it very close. So as you may know, Fostering Connections added a Title 4B plan requirement surrounding healthcare coordination and oversight for children in foster care. This law creates 2 additional requirements for this provision. One is that states must now provide an outline of how the agency will monitor and treat emotional trauma. And the other one provides protocols for the use and monitoring of psychotropic medications. And I am going through this quickly, and so I want to let you know that you don't need to take too many notes. There are copies of the presentation up here, and we also have an IM that's out that will provide more detailed information. The law also adds 2 additional Title 4B plan requirements. The first one is requiring the agency to describe activities undertaken to reduce the time that children under age 5 are in care, and to address developmental needs of children who are served under both Title 4B and Title 4E. The second requires that the agency describe the sources it uses when compiling data on child maltreatment deaths. And there are a list of certain sources that, if are not included, the agency must describe why they're not included and how they're going to include that information. Next, I'll speak about the changes made to Subpart 2 of Title 4B. And as you probably know, this includes programs like caseworker visits, regional partnership grants, and the court improvement program. And changes were made to all 3 of those. So in general, this reauthorizes promoting safe and stable families. The reauthorization authorizes $345 million in mandatory funding and up to $200 million in discretionary funding. Again, all of these changes went into effect October 1st of this year. The law made several changes to the general requirements for promoting safe and stable families. First, I'll talk about the Title 4B Subpart 2 plan. Agencies now have to describe some additional activities, including how the agency identifies which populations are at the greatest risk of maltreatment, and how the agency is working to target those populations with services. The law also contains some requirements for HHS. One of these is that we make the Title 4B annual expenditures and service reports that states submit to us and the tables containing the national totals accessible on our website. The law also amended several definitions that are used for all of Subpart 2. It now includes mentoring as part of family support services. So this means it allows Title IV-B Subpart 2 agencies to claim for mentoring as part of family support services. It expands the definition of time-limited reunification services. So this can include some additional items: mentoring, support groups for parents, services and activities to facilitate parent access and visitation to children, just a few. It also amends the definitions of Indian tribe and tribal organization. Those two definitions are now consistent across Title IV-B, Subpart 1 and 2. It just references back to the same definition in the Indian Self-Determination and Education Assistance Act. So moving away from the more general requirements, the law makes some changes to monthly caseworker visits. First, it makes changes to the actual standards for monthly caseworker visits, and they're subtle, so listen carefully, read them over. For each fiscal year for 2012, so the fiscal year we're in right now that started the 1st of October, through 2014, so that would be September 30th, 2013, agencies must ensure that the total number of monthly caseworker visits to children in foster care is not less than 90% of the total number of visits that would occur if those children were visited monthly. A little different. So you have the total number of visits that would have occurred. The number of visits that occurred must be not less than 90% of that. So every child should be visited monthly. So the total number of the visits has to be at least 90% of if there was a monthly visit for every child. And more information is coming on this. This is the first time. It's because it's talking about taking it out of the total number of visits that would have occurred if the child was visited per month, which is I'm trying to remember the exact phrasing of the law previously, but it's basically what's being measured out of it. So it's the total number of all visits out of the total number that should have happened.
Right now it's each and every month.
Each and every month, right.
If you miss a visit, you're done.
And that does increase fiscal year 2015 to 95%. And we'll have more information on this. This isn't going to be the end all of all the information that is provided on the caseworker visits. Additional requirement is that at least 50% of the caseworker visits are going to have to occur in the child's residence. And that's something that's going to be connected to the reduction in FFP if that standard is not met. Also, there's small adjustments saying that the funding for caseworker visits must be used to improve the quality of the caseworker visits. I will take questions afterwards as well. And I know these make a lot of changes. There's a lot of additional information that's going to be posted to our website, and as I said, an IM that'll be up there shortly as well. The law also made some amendments to the requirements for the regional partnership grants. You might know them as RPGs or the METH grants. These are still focusing on helping children affected by substance abuse, but the law removes the specific emphasis on methamphetamine abuse. The grants are extended for 2 additional fiscal years, but at a reduced federal match. And the law does specify that grantees can apply for and receive multiple grants. Another requirement on us is that we have to evaluate and report on the effectiveness of the current grants and provide an analysis of grantee success in meeting performance indicators and addressing the needs of the families with substance abuse problems. And I'm sure you all are familiar also with the Court Improvement Program. The law made some changes to the structure, the funding, and the purposes of these grants. CIP has 3 grants, the basic, the training, and the data grant. The training and data grants have the same allocation amount, but the mandatory allocation for the basic grant has changed to $9 million. It was previously $10 million, plus 3.3% of discretionary funding for Subpart 2. The law also creates a new tribal Court Improvement Program grant, which is separate from the State Court Improvement Program grants. And this has $1 million allocated for these grants. So the law restructures the application process for states. Rather than submitting a separate application for each CIP grant purpose, there's now one application required, just indicating which grant the state is applying for, basic training and/or data. The law also makes a small change to both the purpose of the state CIP basic and training grants to include concurrent planning and increasing family engagement to the purposes here. The law also created a new subpart 3 for Title IV-B. This concerns data and reporting standards. We have to regulate some standard data elements and reporting standards for information that 4B agencies are required to report. These data elements and reporting standards, to the extent practicable, must meet certain requirements. And these requirements are around being non-proprietary, a computer-readable format, being capable of being continually upgraded, things like this. And it has to be developed as part of a work group. The effective date is October 1st, 2012. That's when it's required to be completed. That's all I'll say. As I said before, there are also some amendments to Title IV-E. It makes some changes to the case plan and case review requirements. You might remember the educational stability case plan requirements that were added by Fostering Connections. You might recall that these were applied only to a child's initial placement into foster care. When we provided guidance on this, we suggested and encouraged you to do these activities to ensure that the child's educational needs were being met every time they changed placements. And we're happy to say that the law now reflects this and is required that these activities be undertaken every time the child changes placements. In addition, the case review system now requires 4A agencies to provide every child age 16 and older in foster care with a credit report and to help the child to interpret this report and resolve any inconsistencies. Another Fostering Connections provision, the Adoption Assistance Reinvestment provision. So you might recall that Fostering Connections gradually delinks eligibility for 4A adoption assistance from AFDC eligibility and SSI income criteria. And the agencies were required to spend any savings from these changes on child welfare programs that could be funded under 4B and 4E. The reauthorization adds a requirement that agencies have to document how they spend these savings if there are any savings. And for both this, the case plan, and the case review changes, we are going to have some plan amendments coming out and some guidance coming out along with that will explain what needs to be done to document and comply with these requirements. Here's some exciting news, I think. The law authorizes new demonstration projects. You might know them as waivers. These projects are going to permit 4E agencies to use federal funds to test innovative approaches to child welfare service delivery and financing. You probably know that our authority to authorize new projects expired, so this creates a new authority. In addition, tribes that operate a Title IV agency can apply for these demonstration projects. These projects could be conducted for up to 5 years and can be extended by HHS. And all current and new projects have to end by September 30th, 2019. The law creates some new application requirements. I'm going to go over these very generally today. There'll be more information, of course, available on our website. So the application is going to have to describe changes or plan changes to policies and procedures that will achieve the goals of the project and demonstrate that the project is designed to accomplish one of 3 specified goals. And the 3 specified goals are very general. They are to increase permanency and promote successful transition to adulthood for older youth, increase positive outcomes for children and families, and improve the safety and well-being of children, very general, and prevent child abuse and neglect and re-entry into care. In addition, the applicants are going to have to implement at least 2 child welfare improvement policies within 3 years of the application. And there's a very long list of what these policies can be. Some of them are right in 4E, operating a guardianship assistance program, extending 4E up to age 21. Those are some of these projects that are included here. Other ones are a foster child's bill of rights, from very big programs to smaller projects. At least one of these policies has to be new, but one of them can be one that the state is already implementing. Another requirement is to account in the application for any federal, state, local, and private investments that have been used for the past 2 years for the same services that will be provided under the waiver. And also submitting a pledge that there'll be an annual accounting of those same funds. Another small change to the waiver requirements is that while agencies can still propose experimental research designs with random assignment, HHS cannot consider that specifically when assessing applications. It's not prohibited, but we just can't consider it in the application review. In addition, we must now consider the applicant's ability to implement a CFSR program improvement plan in approving the demonstration project application, and also the applicant's ability to comply with any court order that's in place that determined that the agency's program had failed to comply with 4B or 4E. Just a few more new requirements. Agencies are going to need to submit periodic reports on the projects to HHS, and in turn, we must report to Congress on the waivers and recommend some administrative and legislative changes based on the findings of the projects. And these became effective upon enactment of the law, and we'll have much more information coming out on those soon, I'm sure. One miscellaneous provision, the General Accounting Office must report on what alternative sources of federal funding are being used for the same purposes as 4B funding, and also assess the needs of families eligible for services under 4B, and identify some underserved communities, and also get some information on caseworker workloads and wait times for families to receive services. And I know I rushed through this. I want to leave time for questions. Again, emphasizing that resources are going to be posted to the Children's Bureau website, so we'll have a marked up, all new text of Titles 4B and 4E as amended. We have IM 1106, which provides a great summary of all the provisions from this law and what has been changed. We'll have updated information on grants. We'll have information on those 4E amendments and some guidance on how to comply with those requirements. And that's all available on our website. So I'm going to leave some time for questions if we have time, and I'm sure I'll be told if we don't. And I'm also putting my email address up here. You can feel free to contact me if you have questions about this presentation, or also always feel free to contact your regional offices, ask them questions. They can help you as well. What was that? Okay, great. So we do have time for questions. Does anyone have any questions? Yes?
Can you just explain with the caseworker visitation how that's different than what we're already reporting? When we did ours, I believed that it was our percentage. We had Measure 1 and Measure 2. Measure 2 was the number of visits in the child's primary place of residence. So for Measure 1, the child is visited each and every month. I was under the assumption that our percentage was already based off of the number of visits that occurred versus, like, there's a formula that ACF had already provided us with. So how is this any different?
I'm having a little trouble describing the differences right now, and I do apologize for that. I encourage you to look at the IM to get more details on that, and look for the follow-up information that we're going to provide to explain the differences a little more, and explain what standards you're going to need to meet. There will be something specific to caseworker visits that will come out, I'm certain.
Okay.
And I apologize again for not having an answer for you today. All right, if there's no questions, thank you. And again, if you wanted a copy of the presentation, didn't get one, there's some on the front tables right here. Thank
The mad flurry to come to the front for the copies. Elizabeth, can we also have a copy of that presentation for the jump drive? We'll also make sure that we have a copy of that presentation posted on our website as well, so that they can go on their jump drives. Okay, okay. Great. Well, we made it. We made it. Jam-packed 2 days, huh? Just a pulse check. Was it worth your time? Yes? Okay, great. So I thank you for spending time with all of us here. And I thank you again just for your commitment. And I just say, continue going out and doing good. And so that's it for me. And that's it from the NRCA. And I'm going to bring O.J. Morgan up.
And let's also give a round of applause just for Natalie, too. They're a wonderful team to work with. We appreciate all that the NRC has done. I want to thank them and also all the other TNTA network. Like Natalie, I want to thank all of you for all the great work that you're doing. It's been just a tremendous experience for the last 2 days. The energy from the field. Together, we're going to make things work for kids and families, and we appreciate you being here. The Bureau, we're thinking a lot about how to keep this energy going and how to bring you together again in a lot of different ways over the next year. I hope to see a lot of you before the year's out. We will see you again next year, hopefully around the same time. We may have a different offering for you at that time, so get ready. But in the meantime, safe travels if you're leaving. I'll see some more of you tomorrow at the NASAP and Foster Care Managers meeting. So thank you all.